Hey guys, and welcome to Stretch Pilates Studio. In today's session, we're going to focus on knee pain. We're going to work on quadricep setting, getting your thighs to work properly, standing glute work to strengthen your bottom, myofascial release to loosen up the thighs which will be tight, trying to compensate for weakness, as well as flexibility, trying to get your kneecap to move well and your knee to function properly. So we start seated on a mat with your leg out in front of you. And you're going to tighten your thigh and lift your leg up and down. You're going to squeeze your thigh and lift up and down, pulling your toes towards your face and trying to sit up as straight as you possibly can. So lengthen your spine through your bottom and keep lifting that very straight leg up and down. To make it more difficult, you can add resistance by putting an ankle weight around your ankles or even using a TheraBand. Or if you don't have any of the above, you can use your shoe and just stick your shoe on your foot and make it a bit heavier. Swap to the other side and you're going to tighten up your thigh and lift up and down. We do 10 repetitions per side. So if you can fit in a few more, you're welcome to go nice and high and do a couple extra, but you want to try and get that thigh tired. Next exercise is a variation of that first one. You're going to lift the leg up, take them out to the side, bring them back to the center and down. And all the while you want to make sure that your kneecap is facing up towards the ceiling and try and really tighten the inside of the thigh as well, getting your vastus medialis obliquus to fire, which is just a fancy word for the muscle above your kneecap. Keep the length through your spine and pull your shoulders back and try and sit up through your bottom. Once you've done 10 on that side, we're going to swap over to the other side. So again, lengthening and resetting your spine. You're going to sit up straight and lift nice and high. When you take the leg out to the side, be careful not to twist your hip open or out. You want to try and still keep your toes facing the ceiling and really pull hard on your toes towards your chest. The next exercise is in standing. So you're going to rise up off your mat and stand on your left leg with your right leg out to the side kicking. You want to grow through that glute on the left hand side. So press your big toe, your baby toe and your heel into the floor and try and make yourself nice and tall through that leg. If needed, you can put your left hand onto the wall to try and help with stability, but it's also a great challenge for the knee to have to balance and keep you upright on your own. Lean your body over to the left hand side as much as you can and try and get your glute on the left to fire. Lift your right leg up and down to the side, but ever so slightly back, and try and make your right bum and your left bum work at the same time. This we really need to get as many repetitions in as possible. So we're looking at between 20 and 30, trying to reach that leg far back and high up. Change to the other side. By now you should really feel that left bum, and so we want to try and achieve the same thing on the right hand side. Lifting the leg back and up. You still want to grow through your feet and the arches of your feet, so you need to apply pressure through your big toe, your baby toe and your heel and try and lift your arch up off the floor so that you're not collapsing in your arch. The arch and the bum are very closely connected. I want you to think about your bum actually pulling your arch up and that being the driving force behind a good high arch. Squeezing that bottom on the left hand side, you want to try and lift the leg as high up as you can and try and get both glutes to fire. Relax your shoulders, relax your neck. It's not supposed to be an upper body exercise. Hopefully there's a nice fire in your bottom. So of course we're going to do a second set. At this point you're going to want to stop, but you mustn't, you can't. You need to keep going. The glutes are very important to the knees. Try not open up your pelvis and try not let your foot reach up towards the ceiling with the top of your foot. Try and keep your heel being the guide. So you want to keep square on as opposed to lifting. You can see we have a fallen member. Man down. But try and get back up and carry on. If you can't do one more repetition, then you can move it on to the other side and just make yourself as even as possible. Okay, ready for the other side. Left leg out to the side and let's lift. Hopefully we're achieving the same intensity on this other leg. Keeping the hips closed off and square, shoulders square. Pressure through your big toe. Don't roll onto the outside of your foot. Make it as hard as possible for yourself. Try and squeeze everything. So close. And stop. Well done. For the myofascial release, you're going to need a foam roller. So hopefully you have one. You can always use a rolling pin and get a friend to roll out your quadriceps as well. It has a similar effect. Basically, what we're trying to achieve here is to roll the quadriceps to neaten up the fibers of the muscle and reduce any tight bands and areas. So you're going to go on your elbows with your roller under your thighs, and you need to roll yourself forwards and backwards, trying to get the roller to move across the entire length of the quadriceps. So it may require you shuffling forward and back, but you don't want to go over the kneecap itself. You want to just go above the kneecap and all the way up to the hip flexor insertion. So it may feel quite overwhelming on the quadriceps, especially the outside of the quads, and you'll see if you turn your toes in and your heels out, it's worse. So I do recommend turning toes in, heels out, and getting into those lateral structures, so the sides of the thigh. Now moving on to the right thigh, you're going to put all of your weight onto your right side and try and roll that thigh. It can be very hectic, but if it's too much, then just maybe do both thighs only. Here you're getting your vastus lateralis and some of the iliotibial band, which is a very tight, sinewy fascia that connects muscles from the top of the hip all the way down to the knee. And it's a very useful fascia, but it can often get tight bands in it. So I would recommend rolling that. Move on to the left side, also trying to get the lateral structures, but if you have a look in the video, you can see that we rolling the underside, the inner thigh of the right leg as well. So that means you're getting a 2-for-1 special, rolling the outside of your left and the inside of your right thigh. And that's a job well done. So we're moving on to the iliotibial band a little bit more intensely. So to roll the ITB, you have to move onto your side and prop yourself up on your right elbow, and then again move up and down the roller using your arm to help push you along. Here we want to avoid any shoulder discomfort and just make sure that you are getting the right ITB and lateral hip structures massage, but not at the detriment of anything else. So now it's time to move on to the other side and do the left iliotibial band. Again, just make sure that that shoulder joint is coping with this movement. You can change the angle of your leg slightly by rolling forward or rolling back and hitting different spots along the way. Don't shy away from the discomfort, just revel in it. Know that it's good for you. Be careful not to hunch over too much. I think we all have the tendency to implode, and when we soar, it gets worse. So just be mindful of the rest of your posture in this position, and try not to collapse into the fetal position. We're going to show you a variation of myofascial release and soft tissue mobilization using rolling devices. So you can use your household items to achieve the same thing. Get a rolling pin and roll out your quadriceps, moving the rolling pin from the outside inside and then from the inside outside again. So just trying to get a massage really. So here we've got two different kinds of apparatus. We have a long thin rod with bubbles on it, and that's, I find that quite an aggressive one. And then we have a rolling pin with two spiky balls that gives you a different kind and depth of massage, and it's more sensory one. So these are excellent tools to use on your inner thigh, trying to get into those inner thigh muscles that can be a little bit tight and overprotective of the knee, trying their best to help you, and then get a little bit chronically shortened because of all the overactivity. So rolling into those muscles can really give you a lot of relief in and around the knee. Onto the other side, the exact same thing, just rolling up and down. I find it easier if you get someone else to help you with this, because torturing yourself can be a little bit tricky, and also if you're sitting up you don't quite get into the hip flexors enough. So lying down on a mat on the floor or on the bed and getting someone to start off gently, because they can go in a little bit hot, but start off gently and chat about pressure. You don't want to overwhelm yourself with this massage. It should be contributing positively, not just making you sore. So you might need to ease off on the pressure, but really try and get the whole thigh involved, inside and outside. And there's no reason you can't do the calves as well. In fact, there's loads of trigger points in the calves trying to help the knee. So spend some time on your calves as well. Good, now we're going to move on to some stretches. So as you can see in our prep position, we have a small rolled towel out in front of us, and that's to try and reduce the discomfort in the knee joint, to open up the knee joint. So you're going to go ahead and get into a lunge position, putting your left foot forward and press your hips forward while picking up your right foot. I do recommend pushing the right foot into the mat before you attempt to lift it off the ground, and that way you're less likely to cramp in your hamstring. The rolled towel is there to open up your knee joint, but I find with some of my knee patients, if the kneecap is particularly sensitive, this stretch can aggravate the kneecap unless you're on a well-padded surface. So our mats are really nice and spongy, but you might need to put a pillow underneath your knee on the right leg. Good, and once you've done the one side, you're going to move on to the other side. So trying to keep your balance and reposition the right foot in front of you. You're going to press the left foot into the floor and then lift it up towards your bottom. And that rolled towel is nestled in behind your hamstring of the left knee. To deepen the knee joint there. If balance is a problem, please do this next to the wall. You don't need to try and over-challenge yourself. You can do this next to a wall and stay stable. Good, 1 to 2 sets should suffice. And here we have another variation of the quadricep stretch, lying on your stomach, and grab hold of your foot. Remember to tuck your tail in this position. So you want to try and push your pubic bone into the mat and really get a posterior pelvic tilt going, and that way the stretch deepens. Keep the rolled towel behind your knee to open up the knee joint. Even if it's not sore, it's really effective, and it just takes the pressure off the knee, the compression of the patella onto the knee. So I love it. I use it all the time. It's very successful when I have clients who have pain in the joint as opposed to discomfort in the muscle. Once you've done 20 to 30 seconds on that side, you're going to move over to the other side. You can see here I've made my roll towel a little bit fatter just to try and help the knees. Tuck that tail, squeeze your bum, and enjoy that stretch. Try to breathe through the mild discomfort in the thigh. You also need to protect your back in this position, so the tucking of your tail not only makes the stretch more effective, but it's really helpful to protect your back. Good, lying down on your back, I'm going to relax your arms at your sides, relax your legs, your toes, your hips. Relax your forearms and your shoulders. Take a deep breath in through your nose and exhale through pursed lips. Tighten your toes, your calves, your thighs, your fingers, your forearms, your shoulders, and squeeze your eyes shut. And then relax everything. Tighten toes, calves, thighs, hips, fingers, forearms, and squeeze. And relax it all. I want you to focus on the quality of your breath. In through the nose and into your tummy. And then exhale again. Take a deep breath in. And as you breathe out, just let all tension go.